So obviously this is something that we've been considering as well, knowing what's been going on around the world. I think the really important points are that, as we all know, the supply of medical masks and respirators is tenuous, and it needs to be reserved for our healthcare workers and for those who care for people with COVID-19 and other patients in hospitals. So that is paramount. Having said that, we know things like physical distancing and hand washing on a regular basis, not touching your face, are proven measures that prevent the transmission of this infection. And we've been practicing our physical distancing, and it is making a difference. So we know those measures work. The use of non-medical masks, so things like homemade or cloth masks, by people who don't have any symptoms, may reduce, in some cases, the touching of your face, although we do need to be careful with putting them on and taking them off, and the importance of washing your hands or cleaning your hands when doing that. But we also know that they can have some benefit in keeping your droplets in. So they're not, we need to be a little bit careful, they're not a medical mask, but they can keep your droplets in when you're out and about with others. What is not proven is that they provide you any protection, and I think that's the really critical part. So if you are going to wear them, it can help reduce the droplets that you shed into the environment, and if somebody is infected and has mild symptoms or early on in the illness, it can prevent you from putting those droplets out, and that's probably okay. But it's not, you can't use it in isolation and think that it's going to protect you and that you no longer need to do things like cleaning your hands regularly or maintaining those physical distance. So in those contexts, I think it's not something that's proven, but it is something that probably does no harm. I think we need to be careful about materials, and we've had incidents in the past where people, particularly people who have lung conditions, if you're not using something that is easy to breathe through and that you can wash and wash regularly, then you can be increasing your risk of contaminating yourself or causing additional problems. So a bunch of caveats, but I'm not against it in terms of if people want to use it as a way to try and keep their secretions in when they're, particularly when they're outside or out in other environments.